name is Dr. Joanna Nazar, and welcome to my segment number 2 on how to build immune efficiency during COVID-19 pandemic. So in the last segment, if you didn't get to watch it, I'm just going to go ahead and do a really quick recap on what we talked about, okay? So we talked about how COVID-19 actually gets into the cell and actually attaches to this receptor site. There is another receptor site as well that it seems like it's getting in through, but once it gets into the cell, it can create a lot of inflammation, okay? And the way that it does it is it actually activates these mast cells and neutrophils in your immune system to actually create a lot of inflammation. And it creates these interleukins, interleukin 1, 6, and TNF, which are actually very pro-inflammatory, which are needed during the acute phase of an actual illness or disease or pathogen attack. So that's very important. The issue that we're finding here is that if you have already chronic inflammation and chronically elevated levels of these interleukins, then when you end up with COVID or a very pro-inflammatory virus, and then you get an increased surge in these actual interleukins, then you end up with compounded inflammation, acute inflammation on top of chronic inflammation. And that is a lot harder on the body, creating more symptoms and creating a harder time to recover. Okay, so it is very important for us to bring down the total level of inflammation in our bodies, so then that way we don't end up with compounded type of inflammation, okay? And so we did talk about consolidation, how it actually affects the actual alveoli and creates a lot of edema and a lot of consolidation in mucus, which can lead to the actual pneumonia, okay? Now, there's a few different things that we can do to help decrease these interleukins that we've seen in research that have been very well documented. That we have glutathione, resveratrol, curcumin, zinc, vitamin C, and quercetin that actually have been really shown to decrease these pro-inflammatory cytokines. So while they actually help your current condition and current inflammation, they can help you also recover from, any other type of inflammation caused by a pathogen like COVID, okay? The other thing about these things is that they're all antiviral as well and antimicrobial, and that's been researched and documented, so we have seen it help against other types of viruses, RSV, hepatitis, influenza type A and B, H1N1. So we've seen it be successful and really help in all these different type of viruses. So we can hope if it's helped those viruses, it will probably also help with COVID. Okay, now last time we kind of talked about all this in details, but today I'm going to talk a little bit more about some other things. For example, the T regulatory cells. Now the T regulatory cells are what actually regulate your immune system, and they're the instructors. They're the orchestrators of your immune system that are going to say, hey, we have a virus or we have, a fungus here, let's do a Th1 response or a Th2 response. So that's what's in charge of immune efficiency and really helping your immune system be able to fight the infection the way it's supposed to and in the best way that it can. There's a few things that help with the Treg cells. All right, omega-3 is one of them. All right, curcumin is another one. Okay, and then also vitamin D and probiotics. So let's talk about vitamin D a little bit. So vitamin D is not a vitamin, it is a hormone, okay? It's a very important hormone, and it's very well known that it helps with many different things, and especially with inflammation. So it does help regulate inflammation. That's why it's good for joints, it's good for gut, it's good for brain function. Lower levels have been associated with Alzheimer's disease and cognitive decline. So it just helps with so many different things. So vitamin D, aside from its anti-inflammatory pathways, it actually really is important for our genetic pool, for our whole genome. So 5% of the whole human genome is actually influenced by vitamin D. So this is really key because we have a lot of genes, and if 5% of them need vitamin D for their function and their expression, then we need a lot of vitamin D, and it's very important. And as a clinician here in Florida, even though this is a sunshine state, I am finding low vitamin D in almost everybody. I actually expect people to have low vitamin D when they come in and we get in labs. And the vitamin D range is from 30 to 100. Okay, so some people are coming in and they're not low, but they're a 32 or they're a 36. And I'm sorry, vitamin D is way too important for too many different things for you to have a 32 when the range is 30 to 100. So I really encourage people to check their vitamin Ds and start to dose appropriately, so then that way they can bring their vitamin D up more to like a 50 or 60. If you do have an autoimmune disease, you need even more immune regulation. So you probably want to have your vitamin D a little higher, closer to around a 70. Okay, but you do want to check when you're supplementing to make sure that you don't over supplement and you don't go past 100, which by the way is very difficult. I've had people high dose for many months, and even some for even a year, and still, you know, get up to a 70 or so. So we consume, I think, a lot of vitamin D, and we need a lot more vitamin D than we ever did before. Okay, because we live in a different environment, an industrialized world, and I just think that our need for it has really increased. So sunshine is just not enough anymore. Aside from vitamin D, the other things that regulate the T cells are actually probiotics. And probiotics are, you know, very well known to help with many different things, but especially digestive issues. So if you are a patient that has IBS, IBD, bloating, or constipation, or, you know, any GI issue, just by taking probiotics, you can help your GI issue, but at the same time, you can help regulate your T cells to help your immune system become more efficient. Okay, probiotics also release interleukin 10 and tumor growth factor beta, which are anti-inflammatory interleukins. So you have your pro-inflammatory ones and your anti-inflammatory ones that are going to fight off inflammation. So the probiotics do that. The other thing that actually does the same thing with interleukin 10 and with tumor growth factor is immunoglobulins. And these immunoglobulins we really find more in breast milk, okay? And in breast milk, you know, that's one of the reasons why it's so good for immune system. It's so good to nourish your children, because you're actually going to be given these immunoglobulins to help with their immune system and at the same time fight off inflammation and help with a healthy formation of a gut. Okay, so if you're breastfeeding, wonderful. Do it and continue, because you're actually protecting your child against any virus, and especially now during this pandemic. Now, if you don't have access to breast milk, it's okay. You can even do immunoglobulins. So immunoglobulins do come in supplements. So if you do have GI issues, if you do have IBS, Crohn's, or any of those, immunoglobulins may be something that you can consider to do to help your health and also help your immune system during this time. The other thing I'd like to talk about is astragalus. So astragalus is also known in Chinese medicine as huang qi, and it is a root. So this is it in its raw form, all right? And I personally love astragalus for many different reasons. So much so that I actually did my thesis on how certain Chinese herbs actually increase mitochondrial biogenesis by increasing the expression of mitochondrial genes. So astragalus in particular has been really well documented to help increase the AMPK gene, which particularly helps in diabetes. So it helps you make more mitochondria in your actual pancreas. But really not just there, it actually helps increase mitochondrial biogenesis in most of your cells and everywhere in the body. And it's one of the reasons why it's actually used in cardiomyopathies. And there's also been some really great studies that I've seen, particularly in mice, on how astragalus helps reduce cardiomyopathies and really decrease the surface areas of these hearts. You know, so it's very interesting to see that. Most of my cardiomyopathy patients, I actually do put them on astragalus, okay, and it helps their breathing. You know, they'll say like, hey, I can go upstairs now and I'm not out of breath. You know, so it's amazing to see how it really does help with those symptoms. Now, this is important too, because we are seeing that with this virus, that one of the complications is cardiomyopathies. And we're also starting to see some literature when they're talking about that there's a possibility that the children that get the variation of the COVID, that they can start to develop cardiomyopathies in the future. Okay, so this is very key, you know, because we can help with those patients. And if you know you already have some of these existing conditions, some diabetes, some cardiomyopathy, or low mitochondrial function, which you would need a functional medicine doctor to help you, you know, kind of identify that, then astragalus is something that you probably really want to consider to do. Now, astragalus does boost the immune system. So if you are an autoimmune patient, you want to be careful and you want to kind of avoid the astragalus unless you're being guided. The astragalus may boost a part of your immune system that can actually, you know, create the immune response. So if you are autoimmune, you want to stick more to the other things we talked about, like glutathione and resveratrol and curcumin and all these things that modulate the immune system, like the Treg cells, okay? The other thing about astragalus is that it actually boosts the immune system. It's been used for actually thousands of years in herbal medicine to help boost the immune system. It's taken during flu seasons, okay? And there's a great formula called Yuping Feng San, which is actually nicknamed Jade's Green Formula. And the main ingredient is astragalus. So what it does, it creates like a screen to keep out the bugs. right? So it's absolutely wonderful for the immune system. And in China right now, they are using a preventative formula for COVID, and one of the main ingredients is astragalus. So it's just very well known to really help with the immunity. Okay, so that's another great option for us. And then we have quercetin, and quercetin is great to reduce inflammation. It's a great flavonoid, and I actually use it a lot with a lot of my patients who have allergies. So patients that have allergies to foods, that have environmental allergies, and patients that have more food sensitivities. So if you are a patient that suffers from all different types of allergies or sensitivities to foods or the environment, you may want to look into maybe supplementing with some quercetin to help with your condition, and also to help reduce the inflammation and help with the immune response during this time during COVID. Now, quercetin is also in the exemplary formula. So in China right now, what they're doing is they're using remdesivir, okay? Remdesivir, and we're starting to use it in the US too, which is wonderful because remdesivir works differently than the chloroquine. So the remdesivir, remember we talked about like if the virus gets in, it needs to release its RNA, and then it makes copies of its RNA, and then actually that's how it replicates itself and makes structural proteins and makes more viruses. So the way that the remdesivir works is it actually stops RNA synthesis. So let's say like the actual COVID gets in through a different receptor site, but it still gets in and it releases its RNA. The remdesivir will stop that RNA from being replicated, which means it will stop the COVID from replicating, and it cannot make more of itself, okay? So this is very key in their treatment, and we're also adapting some of that as well. The other thing that they're doing is intravenous vitamin C, and they're doing the herbal Chinese formula. It's called Fei Pai Du Tang, and it's a formula that's been used for thousands of years for different types of pneumonia and for bronchitis, okay? So really consolidation of the lungs. So it's very interesting how they're really combining Chinese herbal medicine along with prescription, medications and antivirals to help patients get better. So this has been named the official COVID formulation for, TCM, traditional Chinese medicine. And one of the ingredients in it is quercetin. So that's one way that we know that it works, so it is quenching inflammation and it's regulating the immune system. Let me see here. So we kind of went through all of these already. So now you have more options of different things you could do for your immune system. And this isn't all of them, We have echinacea, who has been well researched and documented to be antiviral. We have berberine, which is antiviral and antimicrobial. There's calendula, there's vitamin A. I mean, there's so many different things out there to help your immune system. I'm just going over some of the main ones that I have found that help more with inflammation, that have been studied more and researched and more documented to help more with inflammation and also act as antivirals. Okay, but if you have any questions, you're more than welcome, to send an email. If you want access to any of these, you can go onto my website and you could go to the link where you can actually get access to all of these formulas. And I will also have one of my colleagues, Jennifer Malloy. She's going to be doing a video talking about these things, but also how to incorporate them into your lifestyle, like through food therapy. Okay, and that's really important because if you're eating lots of vitamin C rich foods and on a daily basis, and then you're already saturating your tissues all the time, and then now you're supplementing and getting more C. So she's going to go over that. She's also going to go over dosing with different supplements to help guide you guys through that process. So I want to say thank you for listening. I hope that this information has been useful for you. I hope that it empowers you and it gives you a little sense of strength that you could do more for yourself than just, wear a mask. There's more you could do for your internal environment, and that there's more you could do to protect yourself and protect the people that you love. And if we all come together, we all do our part to strengthen ourselves, then we're going to have more success with this thing. Okay, so remember, it is not just about the microbe, it is about the internal environment. So do everything you can to work on your internal environment to make yourself stronger and make yourself more successful. Thank you so much for your time. Till the next time.